practice game that's sponsored by the Practice Council of SCRA. And this is a long-standing, we've been at this for, I don't know, 4 or 5 years in this context now. And it's always just tremendously interesting to hear from people who are in the field practicing, to give us, exposure to role models, and also to have a chance to talk with them. Next month, Teresa Armstead from the CDC will be speaking, and I've had a chance to chat with her. She's quite a remarkable person, and she was the Employee of the Month in the CDC just recently, which doesn't happen very often. But as I've been talking both with Kelly and Teresa, I'm learning about all these other people who are community psychologists who are in these institutions. Teresa had a meeting of CDC community psychologists, and 10 people showed up and 4 more said they'd love to come, but they couldn't make the meeting. So government's a great place to work. And we'll hear a little bit about it from Kelly, who I've been hearing about for years from Gloria. So I will turn it over to Gloria to introduce Kelly, and then Kelly will take it from there.
Hi all, thank you, Tom. We all owe a tremendous debt to Tom for slogging away to keep practice vibrant and having a number of different opportunities over the years. I come and go, get frustrated with SCRA, but Tom is always in there plugging away. So everyone give thanks to Tom for keeping us going here. I myself, I'm a retired federal employee. I had worked at originally, I'm a native Washingtonian, so my summertime jobs were at different government agencies. Then I was a Peace Corps person, both volunteer and staff. And then, yay, another one, Avery, yay. We always find each other. Then after my doctorate, my career was totally at National Institutes of Health, mostly NIMH. One of the things that I do for SCRA is I have, since I think it's 1990, believe it or not, written a column in our newsletter, The Community Psychologist, in which I profile community psychologists. I try and be diverse about it, gender and age, and certainly in terms of practice and academics. And when there was a certain young graduate student who I had heard about, and I did interview, have interviewed from the most senior people, of which I see Al Radcliffe as one, who I have profiled in that in the newsletter, but also graduate students and what their lives are like. And I believe it was 2004 that I profiled Kelly when she was working on Forever, her dissertation. Was ever going to finish, but not only has she finished, but she has really really moved very well in a career in the federal government. And I've been watching her over the years, partially because we both live in the same town, and seeing a community psychologist where normally nobody knows what in heaven's name we are you social workers, etc. Creating a role, and we have others. We used to have dinners together, and I always thought when we'd get together for dinners, if the academics, if we had more academics in Washington, they wouldn't understand a word we were saying because we talked in government speak, but we all understood each other. I very much encourage people, when you're listening to Kelly, to think of yourself and community psychology skills that you have and that you're learning. has a role in the government, be it the federal government. And remember, it's not just Washington. There are regional offices around the country, state and local government. Community psychology skills are much needed in the federal government. Kelly has, to show you that you can have another life, Kelly also, as many of us have done who work in federal government, have also, if you're interested in teaching, you can also do sideline of teaching. I was so busy that I just rarely had time to do that, but some of the local universities would invite me in to talk to their graduate students. I think, Kelly, I think you actually taught courses. You can maybe tell us about that. But then the other thing that I will always remember about Kelly is that Kelly was, when I first met her, a competitive ballroom dancer. So I always ask her about how the ballroom dancing is coming. One way of getting into the kind of policy work at the federal level is a congressional fellowship every year on our listserv. That's announced. Applications are due. Several of our people, community psychologists, have gotten into federal policy work through the Congressional Fellowship, where they're working on the staff of a congressperson. And I would just, in general, in addition to having a defined pension plan, which I am benefiting from every month, money is put into my bank account that I can pay my bills, etc., and I don't have to scrabble around. I have a great health program also that's so good that I am not even on Medicare. I just use my federal health plan. But most important for me is the kind of scope of the impact you can have. Doesn't mean you're going to have it, but you have the potential. I think maybe Kelly for 4 prior years may have hidden under the radar for a while, but times are good again for community psychology kinds of empowerment, etc. But you can have just an amazing impact from your work. And I will say, nobody ever refused a phone call from me. Gloria Levin is calling from the National Institute of Health or whatever agency, and my calls were always taken. So I'm looking forward to hearing from Kelly. She's a great speaker and a really nice person, as you will hear. So take it away, Kelly.
Thank you so much, Gloria. Gloria's been a great mentor to me since quite a long time ago. And it's great to have you here. And thank you, Tom, for inviting me. This is really exciting. What a nice way to spend a Friday lunchtime here on the East Coast. I did do a short little deck just because government speak, so you can call me out. But then I've reserved, I think, a lot of time for us to just have a conversation and direct things to where you're interested in. So I'm going to try, this is always fun, to share my PowerPoint.
Jadwiga, have you made her a co-host?
Oh yes, that would be helpful.
All right, you should be all taken care of, Kelly.
Great, thank you. I have a lot of things open, apparently. I definitely don't want you to have to look at all my windows. Okay. I'm sharing my screen right now, which is not Great. There, is that
Yep.
the right view for you?
Looks good.
Great. All right, well, I started out, Halloween is one of my favorite, the fall is one of my favorite times of year, and Halloween is particularly fun for me. It was definitely a bonding experience in graduate school for all of us to have annual Halloween parties. And also in my spare time, I'm a kitten foster. So these are 3 of my 4 itty bitties right now. So I thought that I would show you those on a Friday. So I am going to give you a little bit, ooh, sorry about that. I'm new to Zoom, we use WebEx. I'm going to give you a little bit of my background, a little bit of context for federal service, especially in the executive branch, and then talk a little bit about what my career path has been. It's a little bit of a winding road, as Gloria knows well. And then I want to talk in whatever depth you would like about some of the intersections in the work that we're doing now in HHS, in human services policy, and where I see opportunities for community psychologists. It seems like there's a lot of folks who are early career and looking for jobs, so we can definitely spend a lot of time on that. I have a lot of experience and insight as both a job seeker and a hiring manager. Happy to share that with you. So I'll run through these, just sort of whet your appetite, give you some food for thought, and then we'll kind of just do an Ask Me Anything section where we can have some dialogue. In terms of self-locating, I am a queer white woman with substantial economic privilege, trying to do work on behalf of low-income individuals and families. So I sort of hold that identity at top of mind, and that privilege at top of mind in proceeding with my work and in coaching others on their work. Just getting back full circle with the cats, my career trajectory started in college when I thought I wanted to be a wildlife biologist and work with big cats. I envisioned sort of being in the Sahara and studying tigers from the bushes or something. But then I didn't do great in AP biology and decided that maybe a career as a biologist was not in my future. So I thought, well, animal behavior, that's kind of psychology. So I switched my major sort of sight unseen to psychology and just fell hard for it in general. I didn't really know about community psychology, but I was drawn to folks doing the work that sort of resonated with my values. And so when I ended up applying for graduate school, sort of inadvertently applied for a number of community and sort of community related programs. I foster cats to get my cat fix. So I began my graduate career at the University of Missouri, Kansas City, and did work on domestic violence and violence prevention there, and got through the master's part of that program. And the program was doing a lot of reorganizing, and I think the wonderful mentor that I had was shifting to more of a health focus for a number of reasons. And I knew that wasn't for me. And so I ended up, I had been, of course, following Becky Campbell through SCRA for a number of years and her work. And so transferred to the University of Illinois, Chicago to work with Becky, which was wonderful until she moved to Michigan State University. Great for her. And then I finished out my doctoral work with Ed Trickett, which was another wonderful experience. So I did a lot of consulting on the side, and also picking up and moving graduate programs, and moving to a fun city like Chicago was not good for my timeline. So it took me about 10 years I went straight from undergrad until I finished, which I don't think is actually wildly unusual, but it is what it is. And then I sort of took the same approach as I took to graduate school, in terms of applying for jobs, I knew that I wanted to work in policy. I knew I did not want an academic career. I didn't know exactly what that meant. I applied for some jobs on the Hill. I applied in the executive branch through USA Jobs. There's sort of just, looking for things that sounded interesting and where I thought my skill set could be used. I applied for some jobs in research firms that do research for federal government, and miraculously got through the USA Jobs process and got hired on for my first federal job at USDA Food and Nutrition Service. So to just give a little bit of context for federal service, these are all things I did not know when I was sort of where some of you are in my job search. It's an extremely challenging hiring process. There's a lot of policy that I think makes it, attempts to make things sort of fair and accessible to everyone. But over time, I think it's just gotten really challenging for especially sort of high-skilled jobs and candidates that are good fits for those jobs to make their way to hiring managers. So please do not apply for a federal job without emailing me. There are a couple of ways other than the sort of the full and open competition through USA Jobs that my current office tends to hire, and a lot of offices where community psychologists work and are a good fit hire. Of course, the SCRA Congressional Fellowship is on your radar. I would say the AAAS Fellowship, which many of you probably know about, the SRCD Fellowship, Society for Researching Child Development. And then there's also a Presidential Management Fellowship. That fellowship's having a little bit of, some challenges, but they need a really good candidate pool. So I would definitely encourage folks to apply for any or all of those that seem appealing. And federal offices like the ones I've worked in do pull from those fellowship programs pretty extensively. So just sort of some level setting there. Oh, I moved too fast. Also, something to know about before you dip your toe in these waters is sort of the landscape of federal service and presidential appointees. Again, I went into this really unaware, and I think it really depends on where you land in the executive branch. Most of us enter as civil servants, or you enter as a fellow, hoping to possibly then convert to a permanent civil service position. And then depending on where you are, there may be one or more positions at the top of the organization that are appointed directly by the president. Some of those, I think they're around 50. Someone will correct me, that are need to be Senate confirmed. Those tend to be very high level positions, but there are many in between, many leadership positions in between those that need to have Senate confirmation and your sort of senior executive folks who just get given the job. So I think being prepared to work with a really interesting mix of colleagues is important, and knowing that if you sort of, if you're going to have a career in civil service, you work for the people of the United States, but you also work for whichever administration is elected. There's also a completely different incentive structure for a successful federal career in the executive branch than there is in academia. And I know this group and, Tom and Susan have talked a ton with folks about, practice and what that looks like, how it's different from thinking about academia and careers there. But I think, if a practice career is for you and you are wrapping up graduate studies, I think I have advice for where to focus and maybe where what's going to be maybe less valuable as you go on the job market. And I think the conversations SCRA is having about, a practice dissertation and things like that are really important. And I'm very, very supportive of that. The other thing to know about is that policy shifts, especially those that we really aspire to in community psychology, where there are structural changes and we're really impacting systems, have a very long time horizon. So you have to be someone who can kind of tolerate working through multiple congressional sessions, multiple administrations, to maybe, finally get to a place where something really, structural is shifting. And if you get one of those in your career, you're probably extremely lucky. There's lots of other wonderful things you can do, and I'm going to hopefully share some of that with you in a moment. But obviously, you don't come into a bureaucracy like, the Department of Health and Human Services and just sort of, have a bunch of structural changes waiting. So that can be, I think that was a little bit frustrating for me initially, especially when I saw opportunities.
What are you calling? What is the purpose of this call? I have a suspicion.
As I said, I was successful in the blind application through USA Jobs to get my first federal job in the United States Department of Agriculture. And that is the Food and Nutrition Service in particular. That's the division of USDA that runs the federal nutrition assistance programs. So I was hired as an evaluator. For those of you on the market, that's a great series to look for, is the Social Science Analyst series. I think I was successful with this job because I sold my skill set that I had gained as a community psychologist, in particular, research methods, being a consumer of research, being a translator of research, and knowledge of interdisciplinary methods, research, and collaboration. And I sold, I had done violence prevent. I didn't think of myself as a public health person ever before I applied for this job, but I did sort of sell myself in my resume as someone with a public health focus, because I had done a lot of work on violence prevention and also substance use, and some other related things. So I was an evaluator, and I got there my first day and they said, great, we hired you to implement this $10 million study that was just authorized in the Farm Bill. Go to work. So it was definitely a sink or swim moment. I did have some wonderful colleagues and managers. So it wasn't quite as bad as I'm making it sound, but I knew nothing about, I had to learn about SNAP. I had to learn about how research studies are implemented in a federal context. I had to learn how to read legislation, which is, in terms of like being the one responsible for implementing it, was very complex. But it was a wonderful, wonderful learning experience. We partnered with SNAP director in Massachusetts to do the intervention. And then I led the evaluation study for as long as I was there. And it was a crash course in research in the federal policy context. I also did some really fun work on food deserts and thinking about geographic access to food, to grocery stores, and worked a lot on setting level issues in SNAP. So what retailers need to have, where are they, what are the policy parameters that they're asked to operate under. And so those things definitely drew on my community psychology experience. But I kept thinking, like, there's so much more here that if they knew they needed community psychology, they would be doing. So it was a wonderful first job. It was also a little bit frustrating coming fresh out of my graduate program and thinking about all the opportunities and really having a very specific job, which was to be an evaluator and design studies and oversee them. So then kind of an important turning point, 2 positions opened up in the office at the same time, 2 promotions. One was a branch chief for SNAP analysis, which is where I ended up. The other one was the branch chief for, so SNAP is Right Supplemental Nutrition Assistance Program. And it's a huge entitlement program, and a lot of the resources of the Food and Nutrition Service are sort of dedicated to SNAP. There's also, they divide it into the special nutrition side, which is WIC, school meals, emergency food. So pretty much all of the other federal nutrition assistance programs are kind of covered by this other side of the house. So the branch chief for special nutrition evaluation was also open then. And everyone thought that I was very competitive for that job, and everyone thought that I was going to take it. I surprised them all by saying, you know what, if I keep going down this evaluator road, like this is going to be my career. And it was wonderful. But I really was interested in policy and the nuts and bolts and learning more and really stretching. And so I took the branch chief for SNAP analysis instead of the evaluation branch chief job. So it was my first time managing, of course. I had 5 direct reports. And it was I continued to, have research going on in my division, but it was a quick turnaround, policy analysis, legislative analysis. If any bill that was introduced that had a SNAP component, we had to do kind of cost estimates of that. Similar, if the Congressional Budget Office, right, costs out legislation. So we do that in-house for executive leaders. So I was often doing that myself, had to learn how to do it and leading my team to do it. And then we were really responsible for pulling together a lot of various survey and administrative data on SNAP to answer all kinds of questions, put out a lot of reports. So that was definitely a wonderful, I knew what policymaking was after that in the executive branch, and it was a wonderful experience. And I think I wouldn't do it any differently. However, I'm going to show you a little graphic, maybe. So this is the layout of the federal programs that exist to assist low-income families. And you should not be able to read it. If you look at it and say, oh my gosh, then you're getting the message. So this is divided up by the type of service, which is the sort of circle in the center. And then it's color-coded by department that has jurisdiction. And you can see the little red circle around SNAP at the bottom. So that was sort of my box at USDA. And I kept running into families are, yes, when I'm trying to understand why families are having trouble accessing SNAP, why there's food insecurity, why there are food deserts, it kept leading me to intersections with how the federal safety net is structured, how these other programs interact. Many of these programs, right, are all serving the same families in a given community. Most families participate in 2 to 3 programs on average. So staying in the SNAP bubble was starting to be kind of frustrating. And just, starting to get some kind of awareness of that this is actually the root cause of many of the problems with serving families in human services policy made me want something bigger. So I came across an opening for a division director position at the Department of Health and Human Services, and applied and was successful in getting that. I knew a couple of folks who had worked there, and they knew me from some of our collaborations on SNAP data. So that was really helpful. So since 2014, I've been the division director for family and community policy. I got to rename the division a few years ago, which was really exciting. We were the Division of Economic Support for Families, and folks, the public thought that we ran programs, which we do not. And so we just thought, let's talk more about what we do. And so I was super excited to get community policy in my division name. When I'm fully staffed, I have about 11 direct reports. I mostly have policy analysts. So those are folks with masters in public policy or masters in public administration. I have a PhD sociologist right now, which is wonderful. And in the past, I had a historian, which was also wonderful. She was an expert in the history of criminal justice and mass incarceration. And what we really do, going back to that terrifying bubble chart, is try to take a cross-cutting perspective on how individual programs interact and use our position in the Office of the Secretary to coordinate across the department and the federal government. So I should back up and say the Assistant Secretary for Planning and Evaluation is sort of the primary advisor to the Secretary of HHS on policy and legislative development. So HHS is massive. And so this office is in the Office of the Secretary. And then of course there are a number of what we call operating divisions that sort of fall under the umbrella of HHS. So from that position, we really get a lot of opportunity to participate, which I'll talk about in a little bit more detail, to work across the department and across federal government on policy issues and initiatives. We lead the legislative development process for the president's budget, which I'm sure you know about at least from the news, but every executive department puts together proposals that go to the Office of Management and Budget, and then eventually make it into the president's budget. And so we lead that. Human Services Policy leads that for the office, the Administration for Children and Families. We have really close relationships with ACF leadership and staff. They, of course, run most of the human services programs at HHS and kind of have the most, maybe outside of labor, across government. And really, we do mostly quick and medium-term policy research. We do that in-house and also through contracts. We're not a research shop that does sort of these 5 and 7-year evaluations like I did at FNS as an evaluator. And ACF has an Office of Planning, Research, and Evaluation that some of you may know about, and they are definitely the experts in some of those longer term, like rigorous evaluations. And we also sort of, back to my SNAP analysis branch chief, we do a lot of that sort of quick turnaround policy analysis. And I don't think that I would have gotten this job if I had not pushed myself into that sort of realm and outside of my evaluator zone. So just really briefly, our office is divided into these 3 divisions. So as I said, I'm family and community policy. These are the programs that sort of fall in my division. We also have a division of children and youth policy. Sherry Hoffman recently left that position. She's a wonderful friend and colleague. And I've recommended her, a community psychologist out of Vanderbilt. And so I've recommended to Tom that maybe she should come talk at some point. But children and youth policy covers basically the things that focus on early childhood and youth development. And then we have this very interesting division that focuses on economic modeling and supports the other 2 policy divisions. So you can see I went from SNAP to a really big cross-cutting portfolio, which was an incredible learning curve and also exactly what I wanted. My day-to-day, just for a little flavor, I'm definitely a middle manager, and I'm situated between appointed leadership, and then I report directly to a senior executive service person who's just the most wonderful boss I could ever imagine, and a friend. So our appointed leader in human services policy and the SES leader work really closely together as a team to manage the office. I report to them, and then I manage my career direct reports. So as many of you know, even from academic positions and departments and things, middle management is possibly the hardest bureaucratic position, because there's a lot of managing up, and then there's a lot of information that I get that I need to translate for staff in ways that are appropriate, and we deal with some sensitive information. And so there's a lot of thinking every day about communication and who needs to know what to do their job and to best serve families and to impact policy. An actual incredible amount of my day is spent on that kind of communication and relationship management. And that really is the backbone of policy work. It's not Excel. And then just being people who are successful in this environment, I think, have a skill for context awareness, which of course we talk so much about in community psychology, and being sort of politically savvy and interpreting what we're seeing for folks who have different perspectives. So someone had asked about interdisciplinary collaboration, and I don't think so much about disciplinary backgrounds, but we definitely think a lot about where is this person located in the bureaucracy, what's their reward structure, how do we partner best, what do they need to do their job well, what information do they need, how can we help, what are they asking for, but maybe that's not a great role for us. Just a lot of thinking about context, where folks are kind of coming from, who they listen to, who's listening to them, right? So there's a lot of that's maybe the bones of the policy work. So that's the middle manager part, I guess. But I also get to set a sort of strategic vision for both the division and as part of the leadership team for the office. That happens mostly through research planning and the execution of policy research, but also through the legislative development process. I'll talk a little bit more about my perspective there in a moment. I do a lot of editing of other people's writing and documents, like a lot. And I also clear the bureaucracy of clearance. So I see a lot of press releases, talking points, dear colleague letters, rules, all kinds of things that come to us for our input. And basically we're the eyes of the secretary to say, so that's a big part of it. Like in any organization, I deal a lot with human resources, IT problems, and procurement. I talked a little bit about the relationship building and maintenance part of it. As a manager, I guess anywhere, I'm also a problem solver. My style is very much a coaching style, and service leadership, where I'm sort of trying to empower my staff to be the ones out front and to come to me to help problem solve and make sure they have all the contextual awareness that I have. But I'm a lead from behind kind of person, which is very rewarding for me. And then the thing I didn't really, one of the biggest learning curves in this job is the pinch hitting. So as an evaluator in SNAP, especially on the studies that I did, I mean, there's no one, right, who knew more about that than I did. you have to just know so much about the ins and outs and the nitty gritty, much like your dissertation or, you know, a study you worked on for years. So I was really comfortable being really expert in what I was talking about, because I was always talking about my studies. In this job, I get asked to go to meetings and present on other people's work, on meetings I wasn't at, all kinds of things like that. And so to be really quick on your feet and have really good communication with the folks who are the ones who have the information. And then just being, of course, willing to say you don't know, or you'll get back to people. But learning to public speak when I wasn't the expert in what I was speaking about was actually a really big personal challenge. And I'm still working on it. So what I've done in the division with a lot of support from our leadership team is really set up a focus on cross-cutting initiatives rather than kind of covering individual programs in the Administration for Children and Families, which is kind of what the division used to do. So we lead a number of formal working groups. A big one is our Interagency Council on Economic Mobility that we stood up 2 years ago now. I'm going to talk more in depth about that in just a moment. My division is also the lead on coordinating across HHS on family and youth homelessness. And we staff the secretary in his participation in the Interagency Council on Homelessness. My division also leads place-based initiatives and sort of holds a lot of knowledge around those, especially you might have heard of like promise zones from the Obama administration. That was sort of the marquee place-based initiative. There are a number of others. That has been a great place to bring community psychology to bear. And then we do a number of sort of informal cross-cutting topics. Of course, a lot of our work the last couple of years has been on human services response to COVID and criminal justice and reentry is a big focus, although this administration is not doing a lot there yet. I think they're still in the development phase. And then we do a lot on training and technical assistance, sort of building capacity within HHS for folks to think more cross-cutting and about leadership priorities, especially right now around equity. So I'm not going to spend a lot of time on these slides because I want to get to more back and forth, but this is sort of the overview of what we're doing around COVID response. I'm sure a lot of you are thinking about this in your research, but how do we reach folks when they're not going in to an office? How do we get them services and supports? What works best for whom? We can't assume virtual is better for everyone. We can't assume in-person is better for everyone. So how do we sort that out and help programs decide how they're gonna make policy around what those access points look like? We're doing a lot of economic analysis around equitable recovery from COVID. And as I said, we're thinking a lot about emergency response. I think we were all a little frustrated with the delay in human services programs responding to the pandemic. So trying to get people to have something where they can kind of have a jump start. So this is our Council on Economic Mobility. This was actually started under the last administration, but it's morphed quite a bit. And it's really something we've needed for such a long time, which is a business, a career-led structure integrated into how we do business in the executive branch to talk about economic mobility and economic programs in the safety net. So we were asked to chair this, this interagency council. We've got membership from across government. As you can see, the White House is really engaged. We have used it to do some program integration work, some racial equity work. A lot of this is sort of internal facing, but we're hoping to eventually have some more external facing products we're still sort of shifting from previous priorities to current administration priorities. But we've used this structure already to help respond to questions around COVID, right? So when people were realizing, oh my gosh, people are getting released from foster care and there's issues with COVID and housing, we're able to put together HUD and ACF folks, getting word out about equity or economic impact payments, lots of questions about how to get information about those to federal programs at the local level. So we did a lot of facilitation of that, and having this coordinating structure in place was so helpful. And we're hoping to do some real substantive work on program integration in the coming year. Another thing that we're really proud of and working a lot on right now is our sort of portfolio of diversity, equity, inclusion, and access. So these are areas where it's going to be really clear. I've come a long way in terms of being able to bring my community psychology roots into the day-to-day work. So actually under the last administration, we stood up this project on lived experience. So, federal policymakers are sort of notorious for asking people to share their stories and having listening sessions, and then kind of going away, and folks kind of don't know what happened to that information, if it was used. Are we considering what sharing that information cost that person, things like that. So we've starting to do a fairly systematic review of how federal policymakers and programs are engaging folks with lived experience. And is it changing anything? It's a good thing to do, and we value hearing from folks with lived experience, but can we actually share power, or are we promising something we can't deliver on? So that has been, we've had so much support from our leadership, especially now on this. And it's something like 3 years ago, I would have said we would never do a project on that. We've also got a really robust portfolio on social capital, right? So this is the connections that we have to other people and institutions that can really make a difference in human services program operations and outcomes for families. So we're trying to figure out who's doing that work, what are best practices, how to measure social capital, right? It's one thing to say relationships matter. It's another thing to say, if you're not building relationships and connections into your human services programs, you're not identifying a big tool that's available to really help families. We're also doing a lot on equity impact assessments. As you probably know, there's a number of executive orders requiring the government, thankfully, to basically take an equity lens to everything that we do, from grants to contracts to programs, regulations, legislative development. So my team's been leading, in particular, the regulation piece and the legislative development piece. And I have a great team working on that and just focusing a lot on capacity building. One of the things we've learned as career civil servants is that you have to embed these things deep into the career civil service if you want them to transition across administrations. So now is the time to build that capacity to always be thinking about equity and inclusion and program access, and just make it a part of the way we do business, and not a special thing that's just for this administration. And then finally, my team leads the Research Center on Poverty and Economic Mobility. And this is our one grant that we do. It's actually a cooperative agreement with the University of Wisconsin-Madison Institute for Research on Poverty. And with that, we're really thinking about the policy research pipeline. So we really struggle to collaborate with academics, even if they do work on relevant topics. I think, right, academia just doesn't do a great job of preparing folks for applied careers, as you all know. This is our attempt in the next 5 years to really start thinking about, how do we do this? How do we build partnerships? How do we diversify our approaches? how are we making equitable hiring decisions and building that pipeline. So quick recap. I think these are the things that I would love to talk to you more about. You're way ahead. The community psychology is way ahead of the federal government, in particular in the place-based initiatives. I'm just constantly thinking like, oh my gosh, you know, have they never heard of psychological sense of community and, you know, these things. So I'm always digging through my my access to our journals. Lived experience, obviously. The government's finally getting around to like, oh, participatory action research, what's that? And can you do it in federal research? So there's definitely a lot of opportunity there and a lot of open ears. And there's also in our office a fairly new interest in primary prevention that hasn't been something we've historically focused a lot on. We've definitely been working more downstream. So I think with equity right at the center, one thinks about root cause analysis, and that really gets back to racism and how it's built into policy, and relatedly, right, poverty amelioration and primary prevention of some of these things that we've been just sort of triaging at the back end for so many years. I'm sorry, I talked more than I wanted to, so I'm going to stop. But I would just sum up and say that obviously my training prepared me really well to think about systems, knowing the importance of context, knowing my values and what I wanted and where I could contribute and where I thought it wasn't the right place for me to contribute. My research skills, teaching was so great for public speaking and other, public speaking opportunities I had as a graduate student, and then working with advocates, which, I think a lot of us do in our work. Things I had to learn, my programs were not particularly, we talked a lot about policy in sort of a big picture way and thinking more about legislation, but I didn't have any policy analysis skills per se. I didn't really know the policy levers at each level of the system, at the federal, state, and local levels. You always have to learn how to be a good employee. We use like Gmail. So I came to my first job, and on top of all these other things, I had to learn like Microsoft Office. And so like everything is done through calendars and right, like all these big technology things. And it was a long time ago, but it's surprising how much not knowing how to like schedule meetings in MS Office slows you down. Also editing others' work. So I actually ended up taking a course on editing others' work, because I, of course, had edited my own and done journal article reviews and reviewed peers' things in graduate school. But there is a skill set around editing others' work that I did not have. And then I had to unlearn a couple of things, which were perfectionism, right? In our, one reason it took 10 years, right, is because I was insecure about whether I deserved a PhD or not, probably. And just get it done. Just get it done. It doesn't have to be perfect. And I acquired a lot of bad writing habits in academia. If you're going to be a practitioner, I hate to say it, but I have to undo this in a lot of my staff as well. Direct, plain language. You don't want to try to sound smart. You just need to communicate ideas. You have to learn how to write for audiences and know what audience you're writing for, which a lot of people don't. When I first started talking to my staff about this, I'd say, what's the audience for this piece? And they'd say, well, researchers, the public, and program staff. You cannot successfully produce a research brief that is for program staff, researchers, and the general public. Like those are three different things at a minimum. So that, and then I think, executive communication skills. So how to write an email to get an answer is a real skill. and when I get new folks, especially my new PhDs, and I get like 3 paragraphs emails, like it's a very particular skill set to learn. So I will stop there. I will also say again, please don't apply for a federal job without emailing me. A lot of this work that's public is on our ASPE website, and I put both my HHS and personal email here for you. And now I'm gonna maybe stop sharing so I can see you. There you are. Sorry, I was ignoring the chat.
Well, we can open it up.
Oh, good. Yes.
Your questions, and I
Great.
think that was impressive presentation of amazing work.
Okay.
To know that a community psychologist, yes, I agree, is in there. And as we get to questions, I'd like to prioritize people in new careers, who are new to early careers, or students, because you've offered great opportunities and a great vision of what it's like to try to move into that work. So are there people like that who would like to ask a question?
I have a question. Thank you so much. I'm currently a postdoc and I'm looking for applied jobs in New York government right now. And something I've noticed in kind of shifting my CV and my cover letters from geared towards academia towards geared towards applied is it's not really about my research anymore. It's about like the skills I learned from working on those projects. And I was just wondering if you could talk a little bit about how you shifted to like highlighting skills that were helpful in the applied world, as opposed to like in academia, it's all about like the research in your content areas and those kinds of things.
Yeah, that's a great observation and great question. And I think you're spot on. I mean, I think, you know, they'll want to know what substantive areas you're familiar with, but I think, you know, in my context, like I don't really drive the topics. I help refine research questions, but I'm answering policymakers' questions. And, you know, we do work where there's a demand from a program office or something, you know, where we need policy research. So I think, and that was really well suited to me because I had a lot of interests, but I didn't come to my career thinking like, I'm really passionate about homelessness. I only want to work on homelessness and I want to figure out how, right, to keep LGBTQ youth from being homeless. Like that's an amazing career choice. But if that's the sort of scope of what you want your career to focus on, right, then it's going to be hard to be in an office where the secretary wants to focus on economic mobility, you know, for tribal nations or something, you know, like you have to just be able to switch. So you're absolutely right, like pulling out the skill sets. So the methods, you know, right, the different kinds of research projects you've done, the ways you've communicated about them, the briefings you've done, you know, the kinds of deliverables that you've done. Have you done long technical reports? Have you done short briefs? Have you done podcasts? Have you done infographics? You know, all those different kinds of skills for dissemination and communication are really important, along with your methodological skills. And also the cloud, like the relational pieces, right? Like saying that you got 5 different agencies on board for a research project is a really big deal, because that's a big part of your job in government, I would suspect, at the, you know, the state or at any level.
Great, terrific. Someone else who's early in their career or a student with a question. Yes, Dr. Jones-Manson.
Thank you. I'm actually, I just received my PhD in 2020, and I'm working in a fellowship now in the executive branch, actually, just started this year. When you talked about how you didn't have the policy analysis experience, I'm curious, because my experience is working with nonprofits in education, and so I have no experience working in a federal environment. How much support were you able to find to help you kind of close that gap and gain those knowledge and skills that you needed to be successful in the way that you've been with policy analysis? Do you find that there are, besides the wonderful people that you work with, are there opportunities to help you to grow and learn in this particular environment when you're faced with a task that's kind of outside of your comfort zone or outside of your scope?
Oh, that's such a great question. I did learn a lot on the job from colleagues, but I also learned a lot from advocacy organizations and other like think tanks that do policy analysis. So I just sort of read and found those resources and read voraciously. So the Center on Budget and Policy Priorities does wonderful policy analysis pieces, CBPP, Congressional Research Service reports. I had to learn how to score legislation, which was not something I had ever even thought about doing. So I learned that on the job, but the Congressional Budget Office does that. And deep in their website are some fairly technical resources about how that happens. But I would suspect if someone expects you to do that, there'll be some support there. But I think those other kind of the think tanks, and make sure you're looking at think tanks across the spectrum, AEI, as well as, Brookings or Urban Institute. There's many others. But Center for Budget and Policy Priorities is a great place to start thinking about what really good policy analysis looks like. They're an advocacy organization, so there's a clear slant, but it's good. Yeah. Does that help?
Yes,
Great.
Thank you.
Other questions? You'll never get a better opportunity to grill a brilliant, multi-talented federal employee. So go to it.
I have a question. First, this is Leo. I know you love cats, but I had a question about any tips you would give for current graduate students. So I have a couple years left in my program, and I was wondering if you can share some advice in terms of what we can do now to better prepare for a job, working in policy advocacy or directly in the federal government.
Absolutely. I'd say if your university has a policy school and you have the opportunity to do some electives in your program, I know we did definitely at UIC. I don't remember how much of that was available at UMKC, but you'll get to define some of your electives. If you can take some of the classes in the policy school, I think that would be really, really helpful. And then, working with advocacy organizations is one of the best places to, in whatever area of research you're doing, right? So I was doing domestic violence prevention work. So I worked with the Domestic Violence Coalition in Kansas City, and learning how to write for the executive director was really helpful. Looking at what they put out for their stakeholders, one-pagers, talking points, press releases, things like that. That is a great place to learn how things work and get that complementary set of communication tools.
That's great. Thank you so much.
Other questions?
Well, this has been very positive, but maybe Kelly, you could address what I spent lots of anxiety on is the frustrations of working in those kind of environments. I'm thinking now of these minute by minute changes in huge budgetary reconciliation here. And I'm sure they're coming to you. Give us a quick analysis of how this legislative program, might be carried out. And then a day later, you find that that's been dropped. What are some of the frustrations and how have you handled them if you have?
Yeah, that's so on point, Gloria. There's one thing I've been trying to do like many of you probably, moderating my the information I get from the news is really important, and understanding where so much reporting, right, is not from people who really know policy well. So it's really dangerous to read something, even in like a, you know, prestige media, and kind of think you know exactly what's going on. So I do read a lot of news, but I've been trying not to get too wrapped up in that, and like the day to day, and really focusing on just the asks when they're coming, right? What does someone need to know right now? What do we know right now? And trying to get that quick answer, and not trying to, like, sometimes you try to predict and you read something in the New York Times and maybe this is happening and maybe that's not happening. And I think that can really stymie the work. So it's good to kind of have those good boundaries between all of the background noise and like what the ask is in, you know, in your policy context. So we're doing a lot on childcare right now. That seems to be something that's going to be in. It's going to be, you know, substantial. There's a lot to figure out. So we're really like deep into, and that's actually not my team, but we're very deep into childcare policy analysis. Fortunately, it looks like the paid family leave is not, you know, maybe not as high up on the priority list. And so while we have a lot of capacity there, we were just sort of holding back a little bit on doing more, because you know, it's too frustrating to keep doing these iterations every single day with how things are changing. I will say, however, that we are a bureaucracy. And so sometimes I do get information that's really important for my job first through the news and not through HHS. So that's sort of the converse of that. Yeah, I don't know if I exactly answered your question, Gloria, but there are a lot of, yes, so that moves very quickly. By the time you've got an analysis done, they've moved on to a different proposal. You know, we spend a lot of time on the legislative development process, and that often, you know, the president's budget has really changed from a funding roadmap to a messaging document, which has been, you know, frustrating, I think, for some. So yes, plenty of things that we feel like we're spinning our wheels on at times, but, you know, it's an environment where when we do have a win, it's often like something that I feel really good about, like it's going to change the way a program serves families. And so it makes, if you get like 1 in 50 of those, for me, that's worth it.
Want to highlight one of them?
Yeah, so a few years ago, we got a clearance, just, hey, you know, rubber stamp this is sort of generally the feeling. Sorry, there's a vacuum cleaner outside my office. A Center for Medicaid and Medicare was going to change their rules about how funding, how those services could be provided to people reentering from incarceration. And there's a piece in there about what the definition of what community supervision looked like. And so we realized there was an opportunity to make sure that living in halfway houses or in other community settings was not considered community confinement. And so we non-concurred and said, wait, don't do that. Don't do this now. Like, you know, let's talk about, and it was a definition of one word. And we spent months and months and months talking to them about saying, look, this isn't going to cost you any more. You know, the cost is negligible. The health impact is huge. This is a population that needs these services. And we had to get up to the secretary level involved in just making sure they weren't defining some of those residential settings as community confinement, because then, like, right, Medicaid won't pay. And we got it done. And so it made, you know, people are getting healthcare because we caught that in a clearance.
That's great.
Yeah.
Well, you've been amazing. And it's just been such a great education. I'm so thrilled that this is taped because Eric,
Oh, no.
Eric can tell every other faculty member who teaches a policy course to get their students to watch the tape. And luckily, Eric was wise enough to bring his class directly to the class, to your presentation. So thanks to all. The slides you can send to me or to Jadwiga, and maybe she'll put her address in, and then we'll be able to distribute those. You'll go in about a week or so. Jadwiga will have this whole program uploaded onto the site. You go to SCRA, you go to practice, you go to activities, you go to conversations that change your world, and you'll see the past ones, and you'll see this one. So that's recorded there. Thank you all for attending. Enormous gratitude, Kelly. You were amazing, and
thank you.
a real model.